Hey y'all, I wanted to talk about acne, particularly right now, as some of us are struggling a little bit more with it, maybe kind of off of our routines or not washing our face for long periods of time because we're watching movies or doing work from home. So I wanted to just provide a little bit of a background in terms of how to treat it medically when you've exhausted some of the things that you've tried to buy over the counter, and what we talk about in the office in primary care and dermatology. So I want to start with basic washing. So when you have acne, you really want to use products that are super gentle. So a lot of people with acne have increased sebum production, which means more oil. So this kind of drives the clogging of pores, bacteria growing, inflammation, and so washing is a really essential part of acne care. So a lot of products over the counter from the pharmacy, any acne products, most of them have salicylic acid or glycols or alcohols. These are super drying, and so while this drying effect may be helpful in the short term for the oil production, it can actually make acne worse. And so I actually recommend switching to either a non-acne wash product, non-acne soap, or if you want to use something medicated, using something with benzoyl peroxide. Benzoyl peroxide will help with the bacteria, the sebum production, and it comes in 2.5% up to 10%. And it comes in a wash as well as a topical. So if you're using it in a wash, you really want to incorporate it every day or kind of space it out every other day, depending on if you're getting kind of dried out or a little irritated from it. It can cause that, so you can either space it out or lower the concentration of the benzoyl peroxide. The other thing that you can do is apply benzoyl peroxide in a topical form. So it also comes in 2.5 up to 10%. The 10% tends to be like a spot treatment, and the 5% tends to be something that you can use every day. So I like this brand, La Roche. Sorry, I want to take the label off to show you. But it's called Effaclar Duo, and it has 5.5 benzoyl peroxide. Well, it still has the receipt over it, but this is a great product that you can buy at CVS. It's not too drying because the concentration is a little bit lower. There's also ones that are a lot stronger that you can use for a spot treatment, or if you have kind of an area. For me, I always break out right here. So if it's flaring, you can just put the spot treatment all over. That one's called Zap It, but there's other ones. They're basically benzoyl peroxide in the highest concentration of 10%. Those are really great for like topical spot treatments. And then the other products that I recommend going to next after that are medicated. So the ones that I talked about are over the counter. The next set of medications that you can use to control your acne are going to be the antibiotics. So you need a prescription for those. You can use topical antibiotics in the form of clindamycin. That's the most common used form for topical antibiotics for acne. They come in a liquid. They also come in a lotion and a cream. So oftentimes the liquid form is covered by your insurance. I find the liquid form to be pretty drying, to be honest, but I will still use it in a pinch. I like the lotion and the cream forms of the antibiotics. I find that my skin isn't less dried out and irritated from it. But this is always a really great way to control your acne, and you can use it after you wash, pat down your face, use your topical benzoyl peroxide, and then you can use your antibiotic either through the applicator that they give that's like a pat on, or the lotion with clean hands. And after that, you want to use any of your moisturizers. You want your moisturizers to be non-comedogenic, so they're not going to clog your pores. That's what that means. And then use a sunscreen. You really want to use a sunscreen if you're going to be using a retinol or retinoid at night. It's extra important, but a sunscreen every single day on your face and body is super important anyways, even if you're not on a retinol. So next we go to your nighttime routine. So your nighttime routine is super important because you want to wash off all the stuff that you had on your face during the day, all the dirt, all the oils. So you can use either your gentle cleanser or your benzoyl peroxide cleanser at nighttime. Then you want to pat down dry and you want to put on your retinoid or your retinol product. So I prescribe patients Retin A just because it's usually covered by insurance. It's super effective, and then you can put on top of that any like overnight cream that you like. If you have a night cream that you love, it leaves you super hydrated, a brightener, whatever it is, you can put that on top. But the Retin A is a really good anti-aging, anti-wrinkle, brightener, and anti-acne. So this is the other class of medications that we use in the clinic that you need a prescription for, that's super effective for patients. So what Retin A does is essentially, it's a vitamin A derivative. So it actually, when it goes on the top layer of the skin, it directly penetrates into the nucleus of the cells. And what it does there is it actually kind of changes the top layer in that it makes the pores more open. And it takes about a week to work. So if you start using a Retin A at night, don't expect it to act right away. It takes about a week, but it actually reforms that top layer, making it brighter, making it smoother, evening out some of the uneven skin tone, evening out some of the patches of depigmentation or hyperpigmentation that you may have. So we use it for basically a lot of different diagnoses in the clinic, like brown spots, hyperpigmentation, like manchas or melasma after pregnancy. It's really good for that. It's really good at any age, honestly, as long as you're using daily sunscreen with it. And like I said, it keeps the pores open and reforms that top layer of skin, so it prevents new breakouts and keeps the pores open so that the bacteria and the sebum can't get in there and clog it. So amazing for acne and a lot of other things. And you can also play with how it's formulated, gel or cream, and then the concentration. It goes from 0.025%, 0.05%, and 1%. So if you find that you're like super irritated with it, like you use it every day and it causes your skin to be really irritated and red, you may want to go down to a lower concentration, or make sure you're not using the gel form, because the gel form can be drying, and switch to the cream form. The gel form is the best way to deliver the medication. It tends to be the best delivery, it's strongest, but it is really drying. So I actually switched from the gel in my 20s to Retin A cream in my 30s to help with anti-aging, so it wasn't overly drying. Teenagers, oftentimes we recommend like Epiduo or Differin gel. Those are going to be microspheres of Retin A, so it's going to be less irritating. But it's also a good choice for you if you find yourself too irritated to use a Retin A product. And Differin is available without a prescription now, and you can buy it over the counter. So Retin A at night is one of the best anti-acne and anti-aging regimens that you can add to your routine. So I really recommend it. And if you have any questions about it, please DM me or leave in a comment below.